My name is Matthew Edwards. I'm an actuary and I'm editor of the profession's main mortality publication, the Longevity Bulletin. Somebody asked me recently if we could go back to the start of the pandemic and redo a piece of work, redo any work. What would we do differently? What did we not understand back then? And to my mind, the key point relates to heterogeneity, which sounds a bit abstract. So what does it mean? Well, heterogeneity is all about differences between people. In the context of the pandemic, different people can be more or less infectious. In fact, we've all heard about super spreaders. Different people can be more or less prone to get infected. And if infected, different people can be more or less likely to die from Covid-19, with variations not just by age and sex, but by general health, by obesity, by medical conditions. But why does this matter now? Are we going to go back and worry that our models weren't good enough back then? Well, the point is this: we're now in a stage of great transition, hoping that the first wave is nearly behind us, looking to move on. Effectively, the government was faced back in March with the prospect of a mortality catastrophe, and the policy response was to avoid that in favour of an economic shock. So we have had far fewer deaths than many of us feared, far fewer, thanks to control measures such as the lockdown. But given that the coronavirus is still out there and still highly infectious, how can we relax control measures to end the economic shock without still suffering a mortality shock? And the answer lies in that Greek word heterogeneity. We can now assess risk so much better across different types of people. We know who is most at risk from the virus. We can have very focused policies as we cautiously relax controls, and we can have very focused reactions if things pick up again. With much better understanding of the features of past data, we can make much better decisions to improve our future, thanks to this concept of heterogeneity.